Welcome back. Today we are demonstrating the surgical management of displaced base of fifth metatarsal fracture using tension band wiring. Before we begin, the patient is placed in supine position with knee flexed to 90 degree. We mark a 5 cm longitudinal incision starting just proximal to the base of fifth metatarsal, right at the junction between the dorsal and plantar skin. After incising the skin and soft cutaneous fat, a blunt dissection is performed carefully to identify and preserve the branches of sural nerve and short saphenous vein. Next, we expose the fascia covering abductor distal muscle belly and incise it longitudinally. Using retractor, we retract the skin and fascia dorsally while protecting the muscle belly in the plantar direction. This safely exposes the underlying base of fifth metatarsal. Upon exposing the fracture site, we note marked rotational displacement. To assist in reduction, the foot is placed in slight dorsiflexion and eversion. This relaxes the pulling force of peroneus brevis tendon. The fracture is gently reduced back into the anatomical alignment and a thorough wound wash is performed. Interfragmentary compression is temporarily held across the fracture site by pressing the fragment using artery forceps. At this stage, I prefer placing a folded towel under the heel. This elevates the foot and provides much greater ease and better angle for K-wire insertion trajectory. With reduction maintained and heel supported, we proceed to preliminary fixation. At first, 1 mm K-wire is passed perpendicular to the fracture line, which is positioned just inferior to the peroneus brevis attachment. A second 1 mm K-wire is inserted in the similar fashion, which is placed just superior to the insertion of the peroneus brevis tendon. These wires provide rotational stability and serves as a proximal anchor point for tension band. Now, using a 2 mm drill bit, a transverse drill hole is created in a proximal shaft of fifth metatarsal, approximately 2 to 3 cm distal from the fracture site. A flexible stainless steel wire of adequate length is passed through the distal drill hole. The wire is then crossed underneath the 2K wire, sitting securely under the peroneus brevis insertion, creating a classic figure of 8 construct. The ends of the stainless steel wire is held with the plier and given an initial 2 to 3 manual twist to take up slack. The wire ends are then inserted into the specialized tip holes of the wire twisting pliers to continue uniform twisting. Finally, we grip the wire twist directly with the plier and apply firm controlled pressure to achieve maximum dynamic compression across the fracture site. Leaving 4 to 5 neat twists, the excess stainless steel wire is trimmed using a cutter, and the remaining twist is bent flat and gently tapped down with a mallet to make it less prominent. Similarly, the proximal end of both 1 mm K wires are bent, cut short, and hammered close to the bone to ensure smooth, low-profile construct. Following a final wash, a layered subcutaneous closure is performed, followed by skin closure. This completes rigid fixation for base of fifth metatarsal fracture. And this shows our post-operative X-ray of this surgery. If you love to see similar orthopedic related surgical videos, please make sure that you subscribe our channel. Thank you for watching.